My name is Margaret Edwin, the Director of Communications. I will be moderating this session. Joining us today is the main speaker, Dr. Jean Cassia, the Director General of Africa CDC, and we are also joined by the Director of NPHI from DRC, Dr. Dieudonné Mwamba. I will now hand it over to DG to start the session. Over to you, DG.
Thank you so much, Margaret, and good morning, good afternoon, good evening, colleagues. Welcome to the Africa CDC weekly press briefing. As the Director of Communications from Africa CDC was saying, we are today joined by the Director General Dieudonné Mwamba, who's leading the National Public Health Institute of DRC. I'm taking this press conference from DRC because we know this disease X in DRC, and I landed to see what kind of support Africa CDC can provide to DRC. This one we'll discuss after the some highlights regarding Mpox. Let us start with the first slide. That is giving us a new update from the region. As you know, we have 20 countries affected since January. And we also know that the clade 1B was confirmed in Zambia and Zimbabwe. We know, based on effort that Africa CDC is doing, we know that there is what we call the decentralization of the surveillance and the testing. You will see that the testing rate is not ideal one in DRC, where we have a number of cases. In total, for the week 47, we got, unfortunately, 2,700 new cases. And if you compare with the previous week, we had 2,680. It means the trend of the outbreak is still growing. In total, we have 62,171 cases. Even in terms of deaths, if you compare, in terms of confirmed cases, if you compare the previous week and the current week, we see there is an increase. And we are still losing people. Last week, we lost 36 new deaths, and that is bringing a total of 1,200 deaths since January 2024. I wanted also to flag to you that if we compare from the first week, it means the 1st of January, to the week of the last week of November, this is the EP week 47, we have an increase of more than 716%. With this trend, if we continue like that, for sure, at end of December, we'll have more than 800% of cases comparing to 2023. We also know children are are mostly affected, and this percentage is changing every week. And we also know now, based on the evidence that we have, there are more female than male affected. Next slide, please. We wanted to show you, when we say there is a difference between 2022, 2023, and 2024, just have a look on this presentation. You will see the trend in 2024 being more than 372% if you compare with the same period in 2023. We are facing a major outbreak. And we want colleagues from media to help us, because we see there is a kind of less of coverage regarding Mpox while this outbreak is still moving. This is an evidence to share that after COVID, Mpox is the largest outbreak that Africa is facing. Next slide. When we talk about Mpox, we are familiar with that. We are talking about not one, not two, not three, but 4 different outbreaks. We are talking about clade 2A and B. We are talking about clade 1A and clade 1B. And this map is helping you to know where are all of these clades. Even in some places, we have a combination of clades, like in Cameroon, you have clade 2 and clade 1A, while in Kinshasa, you have 1A, 1B together. And this kind of combination, we have it in a number of places. This is what is making Mpox more complicated in terms of appropriate response. Next slide. Let us have a look on DRC. As I was saying, you see the difference in this graph, the difference between number of cases and confirmed cases. Why there is this difference? Because we have a major issue regarding the lab. And this is why our strategy as Africa CDC supporting the government is really to decentralize the lab in DRC. Our previous approach of having only the sequencing capacity at national level, having PCR in some provinces as a group of provinces, this doesn't work. This doesn't work in DRC. This is why we are mostly, and it will be a legacy even for the disease X, we'll talk about it, we need to have the strong lab capacity in DRC. And you'll see also the positivity rate is low because of this lab issue, but also the distance. DRC is a big country, but infrastructures are not at the ideal level. We saw from the report that we received, less than 35% of all samples are reaching labs in the 48 hours recommended. It means within the 48 hours, it means we are, even when we receive samples, we are facing the quality of the samples. And this one is a major issue we need to address quickly. Because today we are talking about Mpox, but we can talk about another disease. When I will talk about disease X, supported by the director, you will understand how this one is affecting, because